The best is yet to come. Your best is inside of you. Your best is yet to come. Your best is inside of you.
Good evening and welcome to The Best Is Yet to Come. I am your host, Stephanie SEIGLE, and once again this evening we have an awesome show lined up for you. And for our new guests, our newcomers, we welcome you to this platform. And to let you know what our platform is about, we are here to be a resource to our community to discuss, topics or things that are plaguing our community, not only to shed light on them, but we want to be a resource and come together that we can try to find a solution for, these things that are plaguing our community. So like I said, tonight is no different. However, before I introduce our guest tonight, I would like to bring awareness to, because this month, May, is mental health awareness. So that's another topic that we want to bring more education on, because you're not what your mental health state or the diagnosis that you've been given. You can live and still have mental health stuff that you're dealing with and working on. So let's, be more mindful of that. Now, without further ado, I would like to welcome to our platform, Lourdes Gonzalez. Welcome.
Thank you so much for having me here today.
Yes. Can you please tell our audience who you are and what it is that you do?
Yes, my name is Lourdes Irizarry Gonzalez. I come from the beautiful and sunny island of Puerto Rico.
Okay.
I am a public health educator, and right now I am a prevention coordinator for High Point Treatment Center Prevention Services.
Okay. Now, you said a public health educator.
Yes.
Share with the audience some of the things that you do in that role.
Public health education is actually a very vast field.
Okay.
We do from one-to-one interventions to program management or program administration, but our main goal is to focus in one type of intervention in one framework and help those that are in need of one-to-one intervention, groups intervention, data collection, data analysis. So health education is a very vast campus to a study field. Okay.
Now, what made you decide to go in that direction with your career?
It is a funny story because I started as an epidemiologist.
Okay.
I started studying epidemiology.
And what is that? I'm sorry.
Oh, that's the study of the statistics and science.
Okay.
It's a combination of statistics and science.
Okay.
All of those illnesses or disorders or environmental issues and factors that can affect a human being, but quantified in numbers.
Okay.
That's basically epidemiology.
Okay.
But I had a realization that I wanted to do something more social.
Okay.
And I had never taken a social sciences course in my life.
Okay.
And I changed my concentrations from epidemiology to health education. And that's how it happened.
Okay.
All of a sudden I was submerged in all this social theories and models and intervention models that I didn't know anything about.
Okay. So how rewarding has it been for you?
Oh, it's been very rewarding.
Okay.
It's been very, very rewarding.
Okay.
Helping people is definitely something that I enjoy doing.
Yes. Now, I know a couple of weeks ago you were part of a forum that was in Brockton maybe 3 weeks ago.
Yeah.
Tell us about that experience.
That experience was great. I was able to share with a lot of people about naloxone, the drug that can save a life.
Okay.
and talking to them about prevention and harm reduction and opioid overdose prevention specifically.
All right. Well, that's good. That's what I would like for us to, delve in a little deeper tonight, because as I expressed, that's what our platform is just to bring more awareness. Last week we talked about trauma, and my guest, I believe you know her, she said that trauma is a gateway drug. And when she said that to me, it was like, wow, I never thought about it like that. And she went further to say that active addiction can save lives. And, she gave an explanation as to why she felt that way. She too has a background in harm reduction. So can you share with the audience, why did you choose to go in the harm reduction path of use, substance usage or addictions?
Of course, of course. Not everybody can get out of addiction as for now. Not everyone is able, not everyone can, not everyone wants to get out of addiction. So harm reduction allows us to help those people that will continue to use independently of what we do and the education that we take them, and help them to live a healthier life. Something that I say is that I don't get to decide whether that person gets to live another day as a mother, as a parent, as a daughter, son, nephew, uncle, aunt. So that's why I started in harm reduction, because I want those people who cannot fight addiction right now to have the opportunity to live, because we all deserve that.
Right. Can you explain to the audience what an overdose is?
An overdose essentially is when you take too much of a drug and the brain becomes overwhelmed. And the brain enables all of our involuntary movements, including breathing. And that's why opioids overdose are so lethal and are so dangerous and are an important topic to assess and attack in our society. Because an opioid overdose can make a person stop breathing.
All right. Now, let's talk about opiates. What exactly, help our audience to understand what that is?
Well, opiates are all of those drugs that come from the poppy plant, the opium poppy plant. The difference between an opiate and an opioid is that one is natural and the other one is synthetic. But our brain, our body does not recognize that difference. So whether you're using a natural opioid or an opiate, a synthetic opioid, our brain cannot differentiate between those. So they both produce the same effect, which in less quantity is this high, this euphoric high that people feel, and when taken too much, it can produce the overdose.
What are some signs that one can look for, signs of an overdose?
First of all, you need to check the breathing. The breathing can be erratic, shallow, or it can have stopped. Another good indication is the color of the skin. If the person is white, it will look a little bit bluish with a bluish tinge to it. And if the person is black, it will look ashen. The skin becomes clammy and wet to the touch. It can become clammy and wet to the touch. And the difference between being very, very, very high and having an overdose is the unresponsiveness. When someone is very high, they can respond to touch, to uncomfortable touch specifically, and when you call their name. If someone is having an overdose, the person will not respond.
Okay. Now you mentioned uncomfortable touch. I've gone through a few trainings. Can you share with the audience some of those touches that are done to stimulate someone that you are in fear of, overdosing?
Of course, if you don't know if a person is going through an overdose or not, one thing that we do is the sternal rub.
Okay.
So we close our fist and with our knuckles, we just do the rub in the sternum. We press firmly so that bone-to-bone contact is so uncomfortable that if the person is not overdosing, they will respond to it.
Okay.
Another uncomfortable touch is the knuckles under the nose.
Right.
Because it's that same bone-to-bone contact that it's uncomfortable for the person, and they will respond if they're not going through an overdose.
Okay. Now, how long should one do that if, say someone found someone and they were afraid that they were overdosing? How long should they do the rubs?
That's something that has to be quick,
Okay.
because when a person is in overdose, time is valuable. It's
Okay.
very, very valuable. So I will just say like a couple of rubs, and if the person doesn't respond, then if you have naloxone available, you can use it, and then call 911.
Okay. Let's talk about that. I know you brought one in. Can you walk us through? I know you don't have your mannequin to actually go through it, but can you talk us through the steps on how to, and at what point should a person use the Narcan?
Okay, of course. I have here the Narcan. First of all, I want to say that Narcan is not a substitute for medical and emergency professionals.
Okay.
So even if you're going to Narcan, that's how we
Right.
that we say it.
What is the correct name for it?
It's the active ingredient is naloxone.
Okay.
Narcan is the brand.
Okay.
But if you're going to Narcan someone, you have to first call 911
Okay.
and let them know that a person with an overdose is unresponsive or whatever it is that you're going to tell the emergency personnel.
Okay.
And then you need to leave the person in a recovery position.
And what is a recovery position?
A recovery position is when it's laying the person on the side
Okay.
with one hand like this, so that
Okay.
they don't choke if
Okay.
they throw up.
Okay.
And this is Narcan. Narcan is a drug that doesn't have side effects, that no allergies are known to the date, and that only is effective when the person is having an opiate or opioid overdose.
Okay.
Narcan doesn't reverse any other overdose. If the
Okay.
person is ODing on alcohol or benzodiazepines or cocaine, Narcan will not be effective.
Okay.
It's only for opioid use.
Now, I'm sorry for cutting. Do we know the reason why it's not effective on the other drugs that you just mentioned?
Narcan is a receptor antagonist.
Okay.
So what it essentially does is that it kicks out the opiate from the receptor and takes its place.
Okay.
So it's very specific.
Okay. All
It's
right.
very specific to that receptor and to displacing the opiate.
Okay. All right. I'm sorry, Nate.
Oh, no, don't worry. Well, this is Narcan. This is the life-saving drug that we can all carry around. And essentially what you're going to do is call 911 and then Narcan the person. You always have to tell the person that you're going to Narcan them, because Narcan can put a person in withdrawal, which is a very uncomfortable feeling, but it can save lives.
Right. Right.
So you just have to pick a nostril, whichever it is that you want. Put the nasal spray in the nostril with your 2 fingers on the top
Okay.
and your thumb on the bottom. You're gonna create a tight seal with your finger,
Okay.
and you're going to just administer naloxone.
Okay. So now that squirt, is that just one dosage or?
Oh, I believe it has 2, and the
Okay.
packet comes with 2 nasal sprays.
Oh, okay.
If the half-life of the naloxone is very short, So a person that you just Narcan can relapse in an overdose in about 30 minutes or so. So you can repeat the Narcan dose if emergency personnel hasn't arrived.
Now, how often can you, and how many doses can you repeat?
Typically, medical emergency personnel will be there in less than 10 minutes.
Okay.
So technically, you will only need one dose.
Okay.
Until the medical emergency personnel comes in. But if the person relapses in the overdose, you can Narcan them like 20 or 30 minutes away.
Okay. All right. So let me understand you correctly. So you should not, within that 30 minutes of time, give another dosage, or is it okay to do that?
You can give another dose if
Okay.
you see every person is different and
Okay.
everybody is reacting differently.
Okay.
Another thing that I wanted to share with you is that during an opioid overdose, the person has stopped breathing. So there's this technique called the rescue breaths.
Okay.
That if the person feels comfortable doing that, it will have to do it. If the person that's helping the other person in an overdose
Right.
can breathe for them until medical emergency personnel arrives to the scene.
Now, is that like the CPR breathing?
It's just like the CPR breathing. You're gonna do 2 slow breaths. Make sure that the person chest and not abdomen is rising.
Okay.
And you can give a rescue breath every 5 seconds. So that will make them around 12 rescue breaths per minute.
Okay.
It's uncomfortable. We are living in a world with COVID now.
Yes. Yes.
And not
absolutely.
everyone is willing to do that for another person.
Right.
But we always recommend to rescue breathe for the person until medical emergency has arrived.
Now, would you do that prior to using the Narcan or after the Narcan to get the rescue breathing?
After the Narcan.
Okay. All right.
And if you don't have Narcan, then the only thing that you can do for a person that's overdosing in opioids is to breathe for them until medical emergency personnel arrives.
Okay. Now, how ready available is the Narcan, and how can is it only medical personnel that have it? Or?
No,
Okay.
no. There was a law recently that allowed everyone to carry Narcan
Okay.
as long as they're trained to use that. So anyone can carry Narcan around. There are resources in our community that have Narcan, and that give out Narcan.
Okay. Now, what are some of these places that give out, and do they offer the trainings also?
High Point is one, the prevention services from High Point. We give out naloxone training and we give out the naloxone kits.
Okay.
BAMC, it's another center that gives out naloxone and Learn to Cope.
Okay.
Also, naloxone can be acquired at local pharmacies.
Okay. Now, how would you, because you said that you definitely need to be trained, so would you need to, say, if one wanted to go into a pharmacist to purchase it, do you need to show some kind of documentation stating that you've been trained?
No, no,
Okay.
you just need to go and ask for Narcan and they will give it to you.
Okay, great.
And it's especially good to have Narcan around if a friend or a family member uses opioids, or if you have opioids in your house.
Okay.
Because you'll never know if a pill gets to the floor and a child is there and the child takes the pill. Anyone can overdose on opioids.
Right.
We typically think of a stereotype, but the reality is that a lot of people use opioids, and overdoses can happen in the house, or they can happen by accident.
Okay. Let's talk about this for a moment if we can. Now, you said that the Narcan is good for opiates. And today, I work down at the Mass Cast program, so I see, a lot of people that are actively using, and a lot of the clients that I work with, they, have confided with me that a lot of, the stuff that they are purchasing off the street is not necessarily, it has other ingredients mixed in and it's man-made. So how can the Narcan, will the Narcan help stuff like that? Like the fentanyl and,
Yeah, fentanyl is an opiate, an
Okay.
opioid, and fentanyl responds to Narcan.
Okay.
So right now, our drug supplies here in the States are very contaminated with fentanyl. Almost everything that someone buys at the street has fentanyl in it. Even the counterfeit pills
Right.
are pressed with fentanyl. And Narcan can definitely reverse an fentanyl overdose.
Okay. Now, can you share with the audience what a fentanyl overdose look like, or does it look similar to an opiate?
It will be the same,
Okay.
signs
Okay.
that any other opioid will give.
Okay. All right. Can you share with the audience some of the opiates that are out there?
Yeah, there's heroin,
Okay.
there's Oxycontin, there's oxycodone, which is Percocet, Vicodin,
Okay.
methadone,
Okay.
and those are some of the most common, Suboxone.
Okay.
Those are some of the most common opioids found in the
Okay.
market.
Okay. Now, I know Suboxone and methadone is also used, what is it, the MAT program, another way of, harm reduction. Do you see overdoses with the Suboxone and methadone?
I haven't seen them personally,
Okay.
but they are capable of doing it.
Okay. And I'm guessing that the what you see would be similar to if it was an heroin overdose.
Yeah,
Okay.
yeah,
All right.
yeah. Every opioid, the opioid overdose looks the same
Okay.
across every opioid.
Okay. All right. That's good to know.
Yeah.
Now, initially in the beginning, you talked about synthetic and
Natural.
natural. Can we share with the audience what the two are? I mean, what the difference between the two?
The natural opioids are naturally occurring,
Okay.
while synthetic are man-made.
Okay.
So synthetic opiates are made in a lab, and by this I don't mean that they're always illegal.
Okay.
We have medicines that are synthetic and that are used in the medical field. We have synthetic opioids
Okay.
in the medical field.
Now, do you know some names of the ones that's in the medical field that's being used that are?
Fentanyl is one of the
Oh,
example.
okay.
It's synthetic and it's used as an anesthetic and it's used when someone is in hospice
Okay. Okay. Wow.
with controlled doses.
Right. Absolutely. Absolutely. So I'm guessing what is being made in the street and press is something completely different.
We are seeing pressed counterfeit pills pressed with fentanyl. We have fentanyl test strips, and that are available at the same centers that we just mentioned that carry naloxone. They usually carry fentanyl drug strips, and this is a very harm reduction process.
Okay.
Because what's behind it is that if you're going to use a pill, if you're going to use whatever it is that you're going to use, you have the right to know if it has fentanyl
Right.
before putting it in your body.
Right.
So we have that also.
Now, can you walk us through what how the strips work and in terms of testing?
I honestly haven't used a fentanyl test strip by myself, so I cannot walk you through the process.
All right. Okay.
But it's simple.
Okay. All right. Okay. That's interesting.
Yeah.
Yeah. Very interesting. Okay. There was something I wanted to kind of segue in, and my mind just went blank, but I'm sure that it, will come back to me. Now you're at High Point.
Yeah.
Now, what exactly do you do?
I am a prevention coordinator for
Okay.
the Prevention Services Division in High Point. High Point is humongous,
Okay.
and it is an inpatient, outpatient, and residential program. But since I work in the Prevention Services Department, I do a lot of community outreach with the naloxone training.
Okay.
We also work with schools in drug use prevention, gambling prevention.
Okay.
So I am an individual that works with this Department of Prevention that
Okay.
goes anywhere that prevention is needed.
Okay. Now let's talk about the youth, our youth. Now, do you see a rise in the usage with them?
I don't quite have the numbers,
Okay.
but we are seeing some worrisome use of substance use
Okay.
in youth, especially with vaping,
Okay.
with nicotine. We are seeing a lot of that in the youth.
Okay.
And well, opioids are used by youth. We know that. We have had deaths related to that. So they're not unreachable for our youth.
Right, right. Now you talk about vaping. Have you ever had any overdosing with the youth or with anybody with vaping?
Not that we know about.
Okay.
The vaping, it's only with nicotine,
Okay.
or it's not only, but it's typically with nicotine,
Right.
and it's very hard to intake an amount
Okay.
so large that you will overdose.
Okay. All right.
But the tricky thing with that is that the teenage brain is still underdeveloping.
Yes.
And when we use substances like nicotine, while our brain is still developing, we can damage that development.
Right.
So that's why we, as a group, we are targeting youth against vaping from a harm reduction perspective, not a non-judgmental and non-preachable
Okay.
point of view.
Now let me ask you this, in terms of working with the youth and from a harm reduction perspective, what does that look like? What exactly do you teach or train them?
We train them in every substance, or we
Okay.
try to train them in every substance, including alcohol, benzodiazepines, counterfeit pills, opioids, nicotine. I don't know if I said that already. Stimulant drugs, because we know that with drugs like Adderall, youth are very prone to use them because they're seen as a study drug. So we do prevention with youth, but it's a broader aspect of prevention.
Okay.
We go a lot to the VOTEX schools, because we have noticed that trades are impacted by overdosing, by opioids overdose in a different way than other jobs.
Okay. Now, do we know why that is?
It's related to how harsh the works conditions are.
Okay.
As Alba said, trauma is a gateway to drugs.
Yes.
Injuries are another gateway to
Yes.
drugs and to addiction.
Yes.
And the wear and tear of a person working in a trade is not the same wear and tear of the body of someone working from a desk.
Right.
So that's why we are observing that the trades are being disproportionately affected by opioid use or addiction.
Because the accidents within that is much higher.
Yeah.
Right. Yeah. That's so unfortunate. I've known people that, had maybe been in a car accident and got severely injured, and, their doctor prescribed them pain medicine, which end result of them, having addiction because after the doctor stopped prescribing, then, they would go to the street to look to buy,
Yeah.
so it's so unfortunate when
It
things like that
is.
happen.
It is very unfortunate. You can develop addiction to opioids from the first use.
Really?
Yeah.
Wow.
And opioids are the only drug known to change the way the brain works.
Why is that? Do we know?
We must know, but I don't know. I don't
Okay.
personally know.
Okay. Well, do you know ways that it changes? Or am I asking you the same thing?
Yeah, I don't know the like the biological sciences behind that.
Okay.
I don't know them, but I know that the brain can change with opioid
Okay.
use.
Okay. Now, is there a period of time of not using it that the brain will, I guess, get healthier? Because I'm guessing that if it's changing it, then the brain is not being as healthy as it should be.
I don't know if the brain can rewire and
Okay.
function the way that it was.
Okay.
But now that you bring that into our attention, opioids are a drug of tolerance,
Okay.
which means that if a person stops using opioids for a while and they start using again, they can overdose, because they will typically start using the same amount that they left,
Yes.
and they don't have the tolerance to manage that amount or that dosage. So it's very important, if a person is going to reuse opioids, for them to know that use less
Okay.
than what you ended with.
Right. It's funny that you say that, because that's something that in a lot of our trainings we are taught that. And I often say, are we actually teaching it, especially from a harm reduction perspective, are we teaching it to the clients? Because, you do have a person that have gone through sobriety for, quite some time, and then maybe a year, and then they use again, and then the first use, they OD.
Yeah, definitely. I also think that we are not educating people the way that we should in terms
Right.
of opioids, and that's one of the main points to be taught.
Right. Now, what are some things that we can do as a community more in terms of getting a handle on this epidemic, if you will?
Well, I am a public health educator, so
Okay.
education is always an answer for me.
Yes.
Educate ourselves, get naloxone trainings,
Okay.
get naloxone. Educate yourself in a very open-minded way,
Okay.
so that you don't judge the person. You don't know why that person uses. You don't need to know why that person is
Right.
using the drug. You just need to help them if they need help.
Right.
So education is one of the key elements for our well-being as a society.
Okay.
And getting naloxone.
Okay.
I cannot emphasize enough how important it is to carry naloxone with
Okay.
you, because you never know when you will be required to use it.
Right. Right. You and I talked briefly yesterday on the phone, and I was very open and tried to be transparent with you. My first thoughts about harm reduction, I was not in favor of it, because I came from a background of abstinence, and sobriety. And having worked in the field and becoming more educated around harm reduction, I do have a better understanding of it. And I must say I'm leaning more towards I mean, of course, I wish that everybody would be able to just stop, go through treatment and stop, but I know that's not the reality for some people. So I do, I have changed my mind in terms of my thoughts on harm reduction.
That's wonderful.
Yes, yes.
That's wonderful. I believe a lot in the harm reduction model.
Now, have you always, or were you like me?
I have always believed in the
Okay.
harm reduction model.
Okay.
I used to work with other populations previous to High Point Treatment
Okay.
Center, and we implemented the harm reduction model, and I am a firm believer in it.
Okay. Now, I know the MAT program, clean needles, safe places to inject, all fall under the harm reduction. Is there anything else that you can share with the audience that fall under the harm reduction model?
The naloxone is a harm reduction
Okay.
tool. Also, we have snorting kits.
Now, what is that?
When a person is going to snort a drug or ingest it via nasal, then they need specific tools to do that.
Okay.
And that's another thing that's becoming more popular at the moment.
Okay.
It's not yet that popular, but it's something that we are seeing.
Okay. All right. And that's what is the reason? I mean, what is the purpose of that particular tool?
To reduce infectious disease.
Okay, all right.
If the person is going to snort with another person, then they will have each the tools required to do the snorting and not have to pass it to the other person.
Okay. Correct me if I'm wrong. I know that I've gone through trainings, and I was told, I learned in this training that sometimes people are encouraged to smoke opposed to injecting because the likelihood of infection and different things.
Yeah, it decreases the likelihood of infection, and
Okay.
another thing is that fentanyl cannot exist under high temperatures.
Oh, okay.
So you will be basically eliminating fentanyl from the drug if you light it on fire.
Okay. All right. So now, if they went through the process of cooking it to use it intravenously, would it eliminate the fentanyl then, or how does that work? Or do you know?
Oh no, you have to put it under direct fire
Okay.
to reduce the effect of fentanyl.
Okay. Oh,
Yeah.
okay. All right.
It has to be combusted, and it has to have combustion.
Okay. All right. Wow. Okay. I know another drug that seems to be part of the epidemic, if you will, and methamphetamine. What is your experience with that in terms of overdosing, and what does that look like? And what category does that fall under?
Methamphetamine, if I am not wrong, is a stimulant. I
Okay.
believe. I am not sure if I'm being completely honest.
Okay.
I don't have much experience because my experience is more with opioids.
Okay. All right.
But definitely it's a drug that we are seeing in our supplies.
Yes, yes, yes. And I know some of the side effects, I don't know if it's, too much usage of it, but hallucination and seeing things that are not there, crawling on the skin. I've worked with people that have, used that in great quantities, and that's some of the side effects that we are seeing.
That's terrible.
Yes.
That must be terrible.
Yes, 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 Anything else you would like to share with our audience?
Well, High Point Treatment Center is a resource that's out there for the community, and we would love to have anyone that needs more information
Okay.
regarding substance use. I can leave my phone number.
Okay. Well, you can give it to our audience if
Yeah,
you.
sure.
Okay.
If you want more information or if you want the naloxone training, you can communicate with me, Lourdes Irizarry Gonzalez, at 508-333-2494. That's 508-333-2494. And I hope that you have enjoyed today's show.
Yes. Before we wrap it up, now do you go around, if someone, say a school or agency, wanted to have you and your team to come out to do trainings, do you all do that?
We do it in what's surrounding Brockton.
Okay.
In the communities that are surrounding Brockton.
Okay.
We can definitely do it.
Okay, so Boston is not part of
We
that.
we haven't been into Boston yet.
Okay.
Yeah.
Okay. Well, it was definitely a pleasure having you and educating us on, and on, preventions and different things like that. So thank you so much.
No, thank you for having me here. It was a pleasure.
Yes.
And thanks all of you for joining.
Yes. Well, once again, you have been joined with us here at The Best Is Yet to Come. And as you know, as we wrap it all up, I bid you peace, love, and blessing always. And remember, the best is yet to come.
The best is yet to